On the Medical Watch for you this afternoon, a close call with a potentially fatal heart attack was a wake-up for the president of a suburban hospital. He was saved thanks to the quick actions and suggestions of the head of the ER. Rhodes is the president of Advocate Good Samaritan Hospital in Downers Grove, where he became a patient in the blink of an eye. And Dr. Dominick Bufalino is an interventional cardiologist who helped save his life. So, Eric, let's talk a little bit about what happened. This, I guess, occurred in a meeting of some sort?
Yeah, I was actually conducting a presentation and felt some shortness in my shortness of breath and tightness in my chest. I'm fit, work out, so it was a bit alarming for me to have that come out of nowhere. And was very fortunate to be in the right place at the right time with some great physicians and a great team, particularly in Dr. Bufalino.
So, doctor, what's the difference between I'm just having a little indigestion and, this is something I need to be checked out for immediately?
Yeah, no, that's a great question. I would think everybody's symptoms are a little bit different. But, in Eric's situation, he has a family history of heart disease. And so he took those seriously. Those are kind of those persistent symptoms: exertional chest pain, shortness of breath with exertion, or just fatigue doing things that you're usually able to do. Those are all scenarios that may give you pause and have you think about, do those symptoms mean something more?
So, Eric, then what did you do?
Yeah, I immediately made it to our emergency room. And, again, to Dr. Bufalino's point, I'm thinking that maybe it's indigestion, and came back, the last test was something much more serious. And so I was very blessed to, again, make sure I was listening to my body and surrounding myself with the experts. And so I just listened to them. And before I knew it, I was headed down for a very non-invasive procedure that ultimately worked out very well.
And it's important to listen to your body, which I know a lot of people are saying, you know what, I'm a little stressed out, or I ate something bad. Is that part of the reason, Eric, you decided to share your experience?
Yeah, absolutely. I'm younger, I'm active, I'm in shape, I eat fairly clean, and, just would not suspect something like this happening. And so, in my mind, if this can happen to me, it can happen to anyone. And so the moral of the story is absolutely listen to your body and get checked out, reach out to your physician and do what they tell you to do.
And Doctor, I understand Advocate Health is offering a free heart health assessment. What can people learn from that?
Yeah, you can understand your risk factors for future cardiovascular events and even undergo a quick screening CT that will understand if you have any coronary plaque or any calcified plaque inside your heart. And that's a risk factor indicator for future cardiovascular events. And so that will really help us tailor our therapies and treatment of you moving forward.
I got to ask, was this the point of the meeting when you were talking about budgets or something stressful that?
Luckily I hadn't got there yet.
Okay. Well, Doctor, I think your department is in order for a good year. Thank you all so much for coming on and sharing your story. I appreciate it.
Absolutely. Thank you very much.
Up next.